Create a Client, created by Shelby King, Andrea Kirkland, and Breana McCurry.
Meet our client, Miss Julia Green, age 66. She lives at home with her husband and is a retired bus driver. She has limited mobility and has fell in the last 5 weeks. She has been pre-diagnosed with type 2 diabetes.
Our focused area for assessment on Mrs. Green is an unhealed wound on her right ankle. Abnormal findings from lab work completed on November 20th include leukocyte level of 10,500 cubic millimeters per unit of blood and a glycohemoglobin A1C level of 10%. The elevated white blood cells indicate a possibility for infection, and the elevated A1C confirms poor management of diabetes. The client does have daily pain, usually from about 3 to 4 on a scale of 0 to 10. Some alleviating factors include as-needed acetaminophen and elevating her leg. Aggravating factors are transferring and ambulation. The effect that this wound has on the client include decreased mobility, limited exercise, loss in sleep due to pain, decreased ability to perform activities of daily living, and diet change due to the inability to cook for herself.
Our first nursing diagnosis is impaired skin integrity related to limited mobility. Our assessment includes incontinence, limited mobility, medical diagnosis of onset diabetes. Overall goal is to maintain skin integrity and promote wound healing. Our expected outcome is for the patient would remain free of wounds and skin breakdown. Our interventions would be to turn the patient every 2 hours, promote high in protein diet, and provide a skin barrier. Our rationale for this is turning the patient takes the pressure off of bony areas, and protein promotes wound healing. Our expected outcome would be to maintain skin integrity and heal existing wounds.
Our nursing diagnosis number 2 is a risk for infection related to unhealed wounds. Our assessment would include vital signs, wound appearance and drainage, as well as white blood count. Overall goal would be to prevent infection in the unhealed wound. Expected outcome would be for the wound to heal without further complications. A nursing intervention would include wound care as well as administering meds. Rationale is keeping the wound clean, and administering meds will prevent infection. Evaluation of the intervention would be wound heals without infection.
Type 2 diabetes can affect our client in several different ways. One way is that it affects wound healing. It may cause delayed wound healing. Also, it decreases the overall quality of life because our client is constantly aware of their disease and they're constantly having to treat themselves for it. It might also affect her self-image. Diabetes can lead to weight gain, visible wounds, and having to treat oneself in public places. And type 2 diabetes also increases the risk for other diagnoses such as heart disease, high blood pressure, and stroke.
The disease process for type 2 diabetes starts because of genetics and or environmental factors. It is when the pancreas is unable to produce insulin or the body becomes resistant to insulin. This develops over time with disruption of normal pancreatic function. Pancreas is overworked, resulting in impaired beta cell receptors and decreased sensitivity to insulin. The liver is unable to receive the body's message that gluconeogenesis needs to stop, causing glucose toxicity to occur. Some of the symptoms that will manifest are excessive hunger or thirst, fatigue, weight gain or weight loss, frequent urination, blurred vision, and also poor wound healing.
Our nursing care priorities would include wound care, a healthy diet, and managing diabetes.
Some nursing interventions for Mrs. Green would include administering medications, including an antibiotic, insulin, and pain medication, monitoring blood glucose levels and managing her diagnosis of type 2 diabetes, preventing pressure ulcers, and cleaning her wound frequently.
One of Miss Green's medications is penicillin. It is an anti-infective medication. Some of the side effects include nausea, vomiting, diarrhea, phlebitis, and rash. Our nursing implications would be to monitor vitals and bowel functions, and the patient is on this med to prevent infection.
Another medication that Miss Green is on is metformin. It is an anti-diabetic. Some side effects would include nausea, vomiting, gas, or diarrhea. Nursing implications include monitoring blood glucose. This patient is on this medication to manage her type 2 diabetes.
The last medication that Mrs. Green is on is acetaminophen. It is a non-opioid analgesic, and its side effects include nausea, headache, stomach pain, and rash. The nursing implications for administering acetaminophen are a pain rating of anywhere from 1 to 10. And Mrs. Green is on this pain medication because she has pain related to her wound.
On discharge, Miss Green's wound has healed without infection, and we have done teaching about her diabetes, and she voices understanding on keeping a healthy diet and managing her diabetes, as well as the importance in promoting good skin integrity in her condition.